Knock, knock. Hi, Mrs. Laerdal. It's me again, your nurse. Gonna give you your morning medications. Can you go ahead and tell me your name and date of birth? Yep, it matches. Okay, Mrs. Laerdal, before we get started, I would have washed my hands, provide privacy, and my patient is sitting up. Before I give these medications, though, I want to do an assessment. So I want to listen to her heart and her lungs, her stomach, check any labs that are pertinent, and I'll get into that in a little bit. But you want to do your nursing assessment, so I'm going to take my stethoscope and I'm going to listen to her apical pulse because I know that one of my medications requires that. So I'm going to listen to her apical pulse. I'm going to get her vitals. Pulse is 80, that's good. I'm going to listen to her lungs. They sound a little crackly at the base. That's okay because she's going to get her albuterol. I'm going to listen to her stomach. I'm going to check any lab values that she has. I'm going to check her urination status because I know Lasix can affect that. I know that she gets Coumadin, so I want to check her INR levels to make sure it's appropriate to give. And I'll get into each of those as we go through them. So I am going to, after I've done my assessment, I'm just going to go ahead and put my gloves on now because I don't want to accidentally touch my patient's medications with my bare hands. You never know what you're allergic to, so it's just best to have gloves on when you're doing this. So now that I'm in the patient's room, I need to go back up to the top. Oh, Mrs. Laerdal, do you want to take these medications, the pills, all at once or separate? All at once? Okay. We will go ahead and start with your albuterol then. So the patient wants to start with her albuterol medication. So what I'm going to do is I'm going to take this out, and if it's a brand new albuterol, then I need to prime it. So you want to shake it. And if it's brand new, you want to prime it like this, just to make sure it comes out. So I've primed it, and I'm going to make sure my patient is sitting up, and I'm going to talk about using a spacer because this helps them inhale the particles a lot better and more efficiently because it collects the particles in, and especially if she maybe can't take a full deep breath in, this will help her do that. So you're going to shake it, and I'm going to educate my patient on how to breathe. So before I give you this medication, I'm going to have you take a deep breath in, exhale out, and then inhale in deep, and then that's when I'm going to give it to you, okay? So before you give the medication, you want to scan the medication. So you want to double click on it, and it will say, please scan the albuterol. And it says the medication matches. Okay. Did I complete my 6 writes and 3 checks? Yes, I did. So I'm going to say okay, and then it will say administer medication. So I'm going to then administer the medication. Okay, Mrs. Laerdal, I'm going to have you go ahead and take just a big deep breath in and exhale, and then inhale, and then you push the medication. I'm going to have you hold that for 5 to 10 seconds. And then exhale slowly. And then you're going to wait about 1 minute between each puff. And after you are done with the inhaler, then you want to have them rinse their mouth out and spit because you don't want it to harm their teeth. So we're done with that one. I'm just going to set that to the side. And now we are going to go scan the Lanoxin. Now this was in a separate container, so this was one that I need to alter. So you have a pill cutter in your drawer, and then you have some alcohol swabs. So you need to make sure that you're opening this, and you want to clean it because just in case somebody else forgot, you don't want any remaining medications on it to affect your patient's dose. So before I open it, I'm going to double click, I'm going to scan it. It says that it matches. And then it says document apical pulse. So before I even do this, I need to count her apical pulse for 1 full minute, and if it's less than 60, I do not give the medication. So I'm going to go ahead and listen to her apical pulse, and what do you know? It's 82. So I can go ahead and give this, and then you would document that apical pulse. So I'm going to open this up. And I'm going to put this in the splitter. And any pill that can be split is scored. So there's a little line down the middle that you can use to line it up. And then you cut it. And then you just put it in the container. And then any remaining medication, you don't want to just throw this in the trash can because a little kid could think it's a Tic Tac. So you want to put it behind you in the sharps container or whatever your policy calls for you to do. And then you want to re-clean your pill splitter. Okay, so I'm good to go with my Dig right there. So now I'm going to move on to the Lasix. I'm going to double click on the Lasix. And I'm going to scan that. The medication matches. And I'm going to just open my Lasix and put it in the container. Okay, and again, while you're opening these medications, you want to be educating your patient and your instructor on the medication that you're giving. So we talked about digoxin and how it's a heart arrhythmia medication, and we're not supposed to give it if their heart rate is less than 60. The same with Lasix. Things that we want to monitor about that are their potassium, how much they're weighing, what their I&O has been. So I've opened the Lasix, and now we're going to scan the Percocet. Now, some of these Percocets don't have a scan on them, but we've taped a barcode to the computers, so then you would just scan that barcode. And the medication matches. Did you complete your 6 writes and 3 checks? Yes, I did. Oh, document pain level. So this is one time where I'm going to have to, I already know that she has pain, because she requested this medication, and it's a PRN medication, so I know that it's appropriate for her to have. It's time. Mrs. Laerdal, can you tell me what your pain level is on a scale of 0 to 10? And she says it's a 6. Okay, so where's your pain? You want to do your whole pain assessment, the PQRST, and do all of that documenting as well. So I will document that. I will open my Percocet and popped it in the container, and I have Coumadin left. So with Coumadin, another thing with Percocet too, anytime you give a narcotic, monitor their respiratory rate and their heart rate, of course. So with Coumadin, I'm going to double click on the Coumadin, and I'm going to scan it, and I need to give 10 milligrams. The medication matches. And it's actually alerting me that I should check her most recent INR, which I've already done, and I know that that is within normal limits and appropriate to administer this medication. So I'm going to open this up, dump that in, and there's 2 of them. They're each 5 milligrams, so that's my 10 milligrams. And so now I have scanned all my medications, so I bring them over to my patient. She's already said that she wants to take them all at once. I've already done all my assessments. I am 100% confident that these medications are safe for her to receive at this time. So, okay, Mrs. Laerdal, I have your medications. Would you like to take them with your orange juice? And maybe she says, no, just leave them here for me. The last nurse leaves them here for me so I can finish my breakfast and then take them. What do you do? Well, I can't leave them here because I need to make sure that she takes them. I've done quite a few assessments in relation to these medications, and so I need to make sure that she takes them. I sure can't put him in my pocket and walk out of the room and come back. That's not safe either. So I say, I'm sorry, Mrs. Laerdal, I really need you to take these medications while I'm standing here so that I make sure that it's safe and they don't get dropped or left on the floor or anything like that. And she kindly says, okay, all right, I'll take them. So you give her her orange juice, she takes her pills, and I'm making sure that they went down and they didn't get stuck in her throat or anything. I clean up my area. I ask her if she needs anything. She wants to remain sitting up because she's finishing her breakfast. Her call light is within reach. The bed rails are up and her bed is in low position. So this is just an example of how we do non-parenteral medications. Get rid of your gloves and then perform hand hygiene. And that concludes this.